Well, reactions to the cancer diagnosis of former President Joe Biden continue to pour in. Mr. Biden is considering various treatment options, with his last official medical visit being in February. And at that time, doctors gave him a clean bill of health. Prostate cancer is the second leading cause of cancer deaths in men. UT Health San Antonio doctor Christian Cluey studies and treats the deadly disease. Our own Julian Martinez spoke with that doctor about the shocking news. Here's a look at that discussion.
Dr. Cooley, everyone's talking about it. President Biden diagnosed with prostate cancer. From all indications, he has a nodule. In addition to the recent reports suggested it spread to his bones. So I want to just identify right out the gate, what is a typical timetable for stuff like symptoms like this to start to develop?
Well, it's actually a difficult question to answer. Prostate cancer can actually be kind of a heterogeneous disease. There's a spectrum of how aggressive something can be. And so we usually look at two things. We ask, one, how aggressive does this cancer look like? When we talk about Mr. Biden's Gleason score, correct? And that was a Gleason 5 that was found on there, which is typically the most aggressive form of prostate cancer. And that can actually spread fairly quickly to the bones, which is what we term advanced prostate cancer at that point, when it has left the prostate and gone to either the lymph nodes or the nearby bones.
Now, when we are talking about President Biden, we are talking about a man in his late 70s, 80s, so an elderly gentleman. With that said, so when we talk about treatment options at his age, what is going to be the most likely recommendations?
Well, typically with somebody that's more advanced stage, the goal is not necessarily to cure the prostate cancer, but more to slow the progression and maintain a good quality of life. And oftentimes, as we look at somebody that's maybe on the older side of things, we're trying to balance how aggressive we should be with intervention. The backbone of intervention will typically be something like hormonal therapy. In other words, lowering testosterone levels to try and slow the progression of the cancer. Usually we're kind of considering what are the competing risks of mortality, how many years of life we expect this person to have normally as well, in terms of how aggressive we'll get with other systemic therapies or other localized focal therapies.
There's a lot of potential causes for why someone may have prostate cancer. But when I think about a president specifically, I think about a high stress position. What impact do you think that may have had? Certainly, there's genetic things that might be in his profile as well. Can you speak to that?
Sure. I think, in general, I think stress can play a role in kind of more chronic health conditions and maybe more rapidly advancing health conditions as well. We certainly see that with other kinds of cancers and also heart disease and whatnot, right? Prostate cancer, though, is going to be one of the most common cancers men will be diagnosed with. There's going to be roughly 315,000 men diagnosed with prostate cancer this year. And honestly, as you look through the decades of somebody's life, roughly 30% of men in their 60s will be diagnosed with prostate cancer, maybe 45% of men in their 70s, and approximately 60% of men in their 80s. So I think the strongest risk factor, honestly, for men developing prostate cancer is going to be that they're men and they're getting older.
Well, let's talk about prevention efforts, because I think that whenever we do see a story like this, and someone certainly as notable as President Biden, it raises awareness. It makes men more focused on their health. What is the proper age to start getting tested for prostate cancer?
That's a challenging question. We honestly are kind of fairly unanimous in that we think younger men should be getting tested earlier. The American Urological Association generally recommends that men start roughly in their 40s getting a yearly PSA blood test. And that's so that we can kind of get a baseline of what somebody's PSA is and look at it year over year to see how rapidly it changes. Now, those guidelines are typically men in their mid-40s and 50s should be getting a PSA test roughly once a year. As we get past our mid-50s, we might switch to maybe every 2 to 4 years. And then certainly as we approach the age of 70, it's somewhat controversial in terms of how often men should get a PSA test and if they should get a PSA blood test.
Interesting. So when we talk about other forms of cancer, certainly like breast cancer, you can feel for a lump, and that's one way to self-screen. Is there any way to really self-screen for prostate cancer at home?
Unfortunately, no. The kind of most sensitive test for the earliest diagnosis is really the PSA blood test. It's a great biomarker because it's fairly specific and sensitive. typically when men actually develop symptoms, they typically have an advanced prostate cancer, as we've seen with former President Joe Biden, where I believe he was having difficulty urinating, some urinary symptoms, and that led to discovery of a fairly advanced prostate cancer. The signs that you'll typically see in those cases might be a rapid change in urinary symptoms, more frequently getting up at night, maybe painful urination, maybe blood in the urine. Unfortunately, those are also sometimes urinary symptoms that just come with being older.
All right, Dr. Cluey, UT Health San Antonio, thank you so much for breaking down this very sensitive subject. And again, hopefully this encourages more men to go out there, get tested, do proper preventative actions to make sure that they themselves are healthy.
Thank you for your time.